Kids fall, they bump, they bruise, but when a small injury turns into a big bleed, the NCLEX wants you to think hemophilia. Hi, I'm Krista, and today let's talk about why these kids bleed, what signals danger, and how nurses stop it. Hemophilia, what is it? It's a genetic defect that causes a deficiency in coagulation factors. These factors help the blood clot when there's an injury. So if there's a deficiency, that leads to prolonged bleeding. So I want you to remember, if it can't clot, it can't stop. This is an inherited X-linked recessive disorder. That means that females are most often the carriers and males are more often affected. There are different types of hemophilia, but the most common ones are hemophilia A, which is a clotting factor 8 deficiency, and hemophilia B, which is a clotting factor 9 deficiency. This is often diagnosed after the client has abnormal prolonged bleeding after just a minor injury. This often happens early in life after something like a circumcision or a loss of the first tooth. Remember, a small injury can end up in a big bleed. For findings, we'll see those signs of abnormal bleeding. We'll see prolonged bleeding and hemorrhage even after a minor injury. Then we'll see bleeding all over the body. We'll see it under the skin as easy bruising, and at the nose as episodes of epistaxis or a nosebleed, and in the urine as episodes of hematuria or blood in the urine. Then we can also see bleeding at the joints that's called hemarthrosis. This is when blood fills that joint capsule and causes symptoms like joint pain, warmth, swelling, and even joint stiffness. So if you have a client where they can't clot their blood and therefore can't stop bleeding, well then your priority is to prevent that bleeding in the first place. So as nurses, we need to prevent and recognize bleeding, and our number one priority is that bleeding prevention. So for any client on the NCLEX at increased risk for bleeding, we need to make sure we initiate those bleeding precautions. So focus on these next points. We have the client avoid aspirin and aspirin-containing medications, because aspirin is an antiplatelet that increases the risk for bleeding. Then we want to avoid invasive procedures that could cause bleeding, things like an IM injection or a rectal temperature. We tell them to use a soft bristled toothbrush and an electric razor to prevent small abrasions on the skin and gums, because even that small injury can lead to a big bleed. If we know there's going to be a lot of bleeding, but we can't avoid it, like during a surgery, we need to give prophylactic factor replacement of whatever clotting factor they're deficient in before that surgery or dental procedure. This helps decrease that risk of abnormal bleeding. So remember, that small injury can lead to a big bleed. So we need to learn to recognize those signs of bleeding. We need to assess for signs of bleeding like that joint swelling from things like hemarthrosis. We teach clients to immediately notify the healthcare provider of signs of serious injury, and we tell them to treat a head injury like an emergency. So they need to immediately report serious trauma like a fall or a motor vehicle collision. We also tell them to look out for signs of internal bleeding. Remember, the NCLEX won't give you a client with an obvious hemorrhage. They'll give you a client with subtle signs of internal bleeding that are super dangerous. Things like cerebral bleeding that can be seen with a headache or decreased level of consciousness, or GI bleeding, which can be seen with black tarry stools. See if you can answer this first quick check. What medications should clients with hemophilia avoid? Remember, those antiplatelets cause increased risk for bleeding, so we want to avoid those, things like aspirin and aspirin-containing medications. Then, what are signs of cerebral bleeding? Remember, those can be subtle yet super dangerous, things like headache and decreased LOC. Then if we have a client with active bleeding, we need to remember that if it can't clot, it can't stop. So our goal is to control that bleeding. We need to give that replacement clotting factor for whatever clotting factor they're deficient in. So for hemophilia A, that's that clotting factor 8, and for hemophilia B, that's that clotting factor 9. So clotting factor can be derived from plasma and given as a blood product, or it can be synthetically created and given as a medication. We can also give desmopressin acetate or vasopressin or DDAVP. This is specifically for hemophilia A because it increases those factor 8 levels. This is also given to treat diabetes insipidus. Remember on your NCLEX to use RICE, that classic first aid protocol for any client with an injured extremity or joint, and we use it specifically for our hemophilia clients in the case of hemarthrosis. R is for rest, to decrease further injury. I is for ice, to apply ice to vasoconstrict and reduce bleeding. Then C is for compression of that joint, and E is for elevation. These help reduce that swelling. Because nosebleeds are common with hemophilia and in children, we need to learn how to manage them. So for epistaxis, we keep the client quiet and calm. Any kind of crying or agitation can increase bleeding. We tell them to sit upright and lean forward. Don't let the NCLEX trick you and pick leaning back as an option. Remember, leaning back can cause that blood to go down the throat and increase the risk for aspiration. Then we apply pressure to the nostrils with the thumb and forefinger for at least 10 minutes to help promote clotting and reduce that bleeding. We apply ice or cold compresses to the nose to help vasoconstrict and reduce that blood flow. We discourage nose blowing because that can dislodge a clot and worsen bleeding. If the bleeding persists, we notify that healthcare provider. They may need more intensive interventions like nasal packing. Lastly, we encourage that low-risk physical activity. We need to encourage exercise, range of motion activities, and physical therapy. Why is this so important? Well, because strengthening those muscles can help prevent that joint bleeding or hemarthrosis and the complications of that, like contractures. Remember, contractures are when that joint becomes fixated in one position and has decreased range of motion. That strengthening and range of motion can help decrease the risk of these complications. We promote those low-risk sports and activities, things like swimming and walking, but we discourage those contact sports where there's increased risk for bleeding, things like wrestling and boxing. Then if they do engage in activity, we tell them to wear that protective equipment, things like knee pads and helmets. We need to closely monitor infants learning to walk. Remember, they are falling all the time and stumbling, so we need to pad those table corners and we need to look out for that bleeding. Remember that small injury can lead to a big bleed. Test your knowledge with this last quick check. What should the nurse give initially for hemophilia to control that active bleeding? Well, remember, they're deficient in a clotting factor, so we give them that replacement clotting factor they're deficient in. What interventions help treat hemarthrosis? Remember, that's that classic first aid protocol, that RICE. We rest in order to reduce the risk for further injury. We apply ice to vasoconstrict and reduce bleeding, and then we compress and elevate to decrease swelling. For epistaxis, should the nurse have the client lean forward or lean backward? Well, remember, we have them lean forward. Leaning backward causes that blood from the nose to go down the throat and increase the risk for aspiration. Now you've stopped the bleeding and you can master hemophilia on your NCLEX.